Since the year 2000, I started in 1989. I was dealing with most mechanical issues of the back and neck and the head and the extremities. But since then, the number of chronic diseases that we are dealing with as a society are skyrocketing. It is a problem that is getting really serious. So diabetes is one of those problems. It's a lifestyle issue, but it has many effects on all your body structures, whether it's a joint, whether it's a muscle, and now whether it's a nerve. And we know we have nerves that go down from the neck and from the low back into the legs and into the arms. So I've been treating peripheral neuropathy for years, but now it's really a serious problem. And my patient base is changing. So when patients come in and they have these varying problems that they didn't have before, then they need new approaches. So we've kept up on those new approaches. So what we're seeing with a diabetic will kill nerve endings. They'll kill their capillary beds. So they'll start to have circulations into their hands, circulation issues into their feet. There's Raynaud's syndrome, which is a autoimmune condition of the nerves and blood vessels in the hands and feet. So the circulation goes away, the hands turn blue, the skin changes, and so forth. So when you have chemotherapy for cancer, chemotherapy causes peripheral neuropathy. Statin drugs cause peripheral neuropathy. Neurological drugs like Neurontin cause peripheral neuropathy. Okay? So all the medications that we use to make us healthier affect the nerves of the arms and legs. And there's different types of nerves. There's small nerve fibers that have no covering to them. There's medium nerve fibers that have a myelin sheath, which is a covering to the nerve to make them work better. And then you have the large nerve fibers that have the most myelin around them. Now, the nerves that are affected first are the small nerve fibers, and the small nerve fibers are the ones that go to your blood vessels. They're the ones that you feel heat and cold into your hands and into your feet. And they're the ones that start to go first. So small nerve fiber neuropathy is the most common because they're unprotected nerves and they're affected most by drugs and by conditions like diabetes and chemotherapy for cancer. So it's very, very important to address this problem now. Now, one of the ways that we address the problem is through vibration. Vibration will increase what's called nitric oxide. Nitric oxide will heal and expand blood vessels. There are bad nitric oxide, but vibration will give you the good one. And the good one will help to increase circulation into your hands and help those nerves and those small capillary beds for your blood flow. The next thing we do is we use light therapy, infrared light. Infrared light will increase nitric oxide and circulation into your hands and feet by 1,300%. It's a powerful way to start to heal those nerves and start to heal the blood vessels of your hands and feet. So peripheral neuropathy is a growing problem. You see it affect the elderly. We have one patient that came in with horrible diabetic neuropathy. She couldn't walk. She had difficult controlling her arms and her legs. But when we started doing her therapy, she had better control of her arms and legs, and we were able to get her up with a walker and start to walk. And that took us a couple years. But that's how we can affect a patient with peripheral neuropathy. Another case of a woman, couldn't write, couldn't comb her hair, couldn't drive anymore, could hardly walk. She's walking, she combs her hair, she does everything that she used to do. And the peripheral neuropathy doesn't affect her that much. And she comes in for treatment once a month or once every other week, depending upon the stress she has in her life, so that she can stay normalized. So I invite you not only to look at us for the therapy that we can do, but there are also a lot of nutritional supports that we can do for a person with peripheral neuropathy. You need to look at how your gut's operating. We need to know if you have food sensitivities, if you have inflammation in your system that we can get rid of. Is there something we can do for lifestyle around your diabetes that will help lower your blood sugar and help your A1C be better? So let's look at these things. Let's take a comprehensive look at a person with peripheral neuropathy, because living with it is hell. Living with it is probably one of the worst things a person can live with in these days. Not being able to walk, not be able to use your extremities, and continuously, year after year, losing more and more. Let's get back into getting things back rather than just watching it degenerate. Thank you.